What if an AI could spot tomorrow's heart attack today, and then text you a personalized game plan to stop it? That future is arriving faster than anyone expected. Across the world, artificial intelligence is stepping into the long, exhausting battle against chronic illnesses like diabetes, heart disease, and hypertension. These aren't headline-grabbing emergencies. They're slow, silent conditions that drain lives and money day after day. Right now, chronic diseases cause roughly 3 out of every 4 deaths worldwide. They also consume over 90% of healthcare dollars. It's a crisis no human workforce can solve alone, so physicians are recruiting an ultra-focused new partner, AI. Picture this. A woman living with type 2 diabetes slips on a discrete, continuous glucose sensor. Every 5 minutes it streams data to a cloud model that's learned from millions of similar patients. When the algorithm detects a pattern pointing toward an overnight sugar spike, it instantly pings her phone. Glucose trending up. Drink a glass of water, walk for 10 minutes, and reduce carbs at dinner. The next morning, her levels stay in range and complications are avoided before they even begin. That isn't science fiction. Digital health pioneer Omada Health just rolled out OmadaSpark, an AI nutrition coach that recognizes risky trends and serves real-time food guidance, even letting users scan meals with a photo. Think of it as a dietitian that never sleeps, backed by a live care team for tough questions. Meanwhile, researchers at the University of Utah have unveiled RiskPath, an explainable AI toolkit that reads years of lab results, wearable data, and social determinants to forecast chronic disease years in advance. Doctors don't just get a red or green light, they see why the risk exists and which lifestyle tweaks matter most. It's like having tomorrow's medical chart delivered today, complete with a step-by-step prevention plan. And on the virtual care front, Teladoc Health's predictive nudges are already cutting A1c levels for thousands of members. By flagging the exact moment a patient is likely to disengage, the system sends encouraging next best actions that triple engagement with human coaches and drop dangerous blood sugar averages almost half a point. So how does all of this actually work? At the core are deep learning models trained on mountains of longitudinal health records. They spot invisible patterns, tiny changes in heart rate variability, sleep cycles, diet logs, long before symptoms trigger alarms. Then, using natural language generation, they translate raw math into plain English tips doctors and patients can act on instantly. Importantly, these tools sit beside clinicians, not above them. Every recommendation flows through a medical professional who knows the patient's story. AI crunches the data. Doctors add context and judgment. Patients get clearer, faster answers. That collaboration is key to trust and to safer care. Let's zoom in on 3 breakthroughs transforming chronic care right now. Personalized prediction. Models like RiskPath reconstruct a patient's digital twin, replaying their past labs and lifestyle data to simulate multiple futures. Adaptive coaching. AI agents, from OmadaSpark to Apple's upcoming glucose forecast, adapt advice hour by hour, keeping daily habits on track. Remote monitoring at scale. Virtual mission control centers use computer vision and biosensor feeds to watch thousands of high-risk patients simultaneously, alerting nurses only when intervention matters. Early results are stunning. Fewer emergency visits, lower medication doses, and longer, healthier lives. And because prevention costs pennies compared to hospitals, insurers are finally paying attention, often covering AI programs in full. Of course, challenges remain. Bias can creep in if training data excludes minority groups. Data privacy must be ironclad, and no algorithm can replace empathy. That's why leading systems keep a human doctor in every loop, audit models for fairness, and give patients full control over their own data streams. So where does this leave us? In the next 5 years, Analysts predict that most chronic disease care plans will include at least one AI-powered tool, be it an app, a wearable, or a virtual coach. Imagine waking up to a dashboard that shows your cardiovascular risk score in real time and suggests a 10-minute workout to push it down. Imagine hospital records that automatically flag the earliest whispers of kidney damage long before lab numbers cross the red line. This is proactive, precision healthcare, and it's becoming the new standard. The takeaway is simple. AI isn't replacing your doctor, it's supercharging your doctor, turning mountains of messy data into crystal clear next steps and giving every patient a fighting chance against the world's toughest chronic diseases. So the next time you hear a notification buzz, it might not just be another message. It could be the sound of AI quietly extending your healthy years. If you want to stay ahead of the curve on how AI is reshaping everyday healthcare, hit that subscribe button right now. Join our growing community of doctors, patients, and tech enthusiasts, and let's revolutionize medicine together. And don't forget to ring the bell so you never miss the next breakthrough.